Hi, in this video I'm going to tell you about osteoarthritis, pathophysiology of osteoarthritis, and risk factors of osteoarthritis. So, what is osteoarthritis? Osteoarthritis is the most common type of arthritis. Most commonly, it is associated with aging and the major cause of joint pain in older people. Osteoarthritis is characterized by focal loss of articular cartilage, subchondral osteosclerosis, osteophyte formation, or bone hypertrophy. Joint involvement in osteoarthritis follows a characteristic pattern from hip joint, knee joint, joints in hands, neck, and then spine. Knee and hip joint involvement are most common in women with age group 45 to 65. Now, what is pathophysiology? Normal joints have little friction with movement and do not wear out with overuse or trauma. And in joints, cartilage has the very important role which is made up of matrix or fluid around 80%, solid phase collagen and protein around 18%, and cells like chondrocytes around 1 to 2%. Under normal condition, there is a balance between matrix and enzymatic activities of cartilage in dynamic remodeling of collagen. But in osteoarthritis, increased degradation of major structural components of cartilage occurs because of overexpression of degrading enzymes leads to loss of collagen and proteoglycans from matrix, which makes cartilage more vulnerable to load-bearing injury. Because of this, slow destruction of cartilage in the form of fibrillation or fissuring occurs, which leads to vertical cleft formation, chondrocytes death, and thus leads to decreased cartilage thickness, which is usually focal and mainly affects the weight-bearing joints. Loss of cartilage leads to sclerotic bone formation and often deposition of calcium pyrophosphate and calcium phosphate crystals in the abnormal cartilage. Subchondral bone stiffens, then undergoes infarction and develops subchondral cysts. Fibrocartilage is produced at the joint margin, which undergoes endochondral ossification to form osteophytes. Bone remodeling and cartilage thinning slowly alter the shape of the osteoarthritis joint, increasing its surface area. In attempt to repair bone and stabilize the joint, subchondral sclerosis and osteophytes formation occurs. The synovium undergoes variable degrees of hyperplasia and inflammatory changes, which causes synovial fluid less viscous with greater volume, although to a much lesser extent than in rheumatoid arthritis and other inflammatory arthropathies. In simple words, osteoarthritis is a process of progressive cartilage matrix degradation to which an ineffectual attempt at repair is made. Risk factors in osteoarthritis. Heredity. Osteoarthritis associated with heredity and some genetic factors. Gender. Women more commonly have osteoarthritis than men. The cause behind this may be associated with hormones and sex hormones. Obesity. Obesity is a very important risk factor in osteoarthritis. So most common joint involvement in obese women is knee and hip. Both are weight-bearing joints. Age. Age is most consistently identified risk factor of osteoarthritis. More commonly, men after 50 and women after 40 may suffer with osteoarthritis. Trauma. Repetitive injury may cause cartilage destruction, and related injuries may lead to osteoarthritis. Occupation. Farmers, sports, and some occupation related to repetitive friction on joints may also cause osteoarthritis. In my next video, you will see about signs and symptoms of osteoarthritis, investigations for osteoarthritis, and management of osteoarthritis. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.